Hi, I'm Marisa Walster, Senior Director and Business Strategy Lead at the Financial Health Network. I've spent my career in financial services, and I am excited to share with you our latest research and model to help organizations advance their financial health impact, the FinHealth MAP. We are currently faced with powerful reasons for why financial institutions should be stewards of financial health for their customers, employees, and communities. The COVID-19 pandemic and related financial crisis has brought focus to the frailty of financial health in America and the important role that financial institutions play. According to the most recent data from the U.S. Financial Health Pulse, more than 2/3 of people in America were financially coping or financially vulnerable as of August 2020. These individuals are struggling to spend, save, borrow, or plan in ways that allow them to be resilient and seize opportunities over time. But this need for support is not new. From our 2019 Pulse data, we saw that 80% of customers expected their primary financial institution to help them improve their financial health. Yet only 14% strongly agreed that that institution delivered. The study also shows that people who believe their financial institution care about their financial health are 3 times more likely to be satisfied, 3 times more likely to recommend that institution to family and friends, and 5 times more likely to be interested in holding additional products. Financial health is good for business too. So why isn't every financial institution focused on improving financial health? In part, it is because this requires a transformation in how organizations think about operating their business, a shift from business-only outcomes to business and people outcomes. Financial health is not unlike the risk management transformation that stemmed from the 2008 financial crisis, or the digital transformation driven by changing consumer expectations for convenience and access. These required a holistic approach, changing goals, perspectives, processes, in coordination across a business. Transforming a business to make a real impact on financial health is no different. We know that the path for each organization will not be the same. They cannot be, for just like each of your customers and employees, they have histories, goals, circumstances that are unique. But that does not mean that this journey to build financial health must be a journey into the unknown. With the goal of making the business strategy of financial health understandable, practical, actionable, and sustainable, the Financial Health Network, with funding from Flourish, a venture of the Omidyar Group, began researching and developing a model for building financial health strategies, the FinHealth MAP. We leveraged our years of experience and worked with our vast network of members to identify proven in-market and advanced best practices. And while we've started with financial services, the MAP can be applied more broadly, and we have our sights set on deep dives for other sectors too. Through our work, we identified 4 common elements of a mature financial health strategy. Vision, the understanding of and commitment to sustainable financial health impact. Infrastructure, existence of resources, capabilities, and internal structures to support that financial health impact. Performance, accountability to design solutions that improve financial health. And solutions, delivery of these solutions that support and improve financial health for all. For each of these pillars, we identified key activities that should exist within an organization to increase impact and sustainability. Take vision, for example. Financial health should be in the organization's mission statement, seen as a value driver for the business, understood by all employees, and promoted internally and externally by executive leadership. We can look at the depth and breadth to which these activities exist to assess the maturity of an organization against each pillar, from initiating to optimizing. One of the most important factors in determining maturity is how broadly financial health is integrated across an organization. So often we see financial health impact start through the efforts of one internal champion or be adopted as a mission of a social impact team. And this is critical and impactful work. But organizational maturity grows when teams and leaders from all corners are driven to impact financial health together. At a financial institution, these should include product teams, customer experience groups, marketing organization, human resources, and community engagement teams. For one organization, this started with marketing, measuring financial health to inform their segmentation strategy, which led to product teams designing features to improve credit, and the integration of financial coaching across customer experience channels. For each organization, the path may be different, but impact is greater when all of these pieces work together. With a FinHealth MAP, we hope to provide a map for organizations to identify ways in which they can mobilize internally and increase their impact on the financial health of all those they touch. So where is your organization on its journey? And what are your next steps for impact? The FinHealth MAP can be your guide. In our forthcoming paper, we dig into the details and provide case studies that show how a number of companies are bringing their journey to life. We hope that you will stay tuned to hear some of these stories in our next session. Then please get in touch. Tell us about your journey and let us know how we can help you take the next step. We are looking forward to improving financial health for all together.